Dr. Sully Sullivan completed many cases with the ArchBridge. He is a KOL of ours. He is a director at 3D Dentists and teaches this surgery in live patient surgery using the ArchBridge. In this example, we're going to discuss using a TAD. Here you can see in the palate, and there are different techniques for having a TAD to preserve the bite through the process. Dr. Sullivan routinely uses the CombiGuide from ROE Dental Lab to idealize bone reduction and implant placement, and that certainly helps in the surgical and restorative protocols for the ArchBridge. In this case that he completed and shared with us, the scans that are required are preoperative, upper, lower bite registration here, picking up the TAD, picking up the fiducial marker. Then the scans after surgery are healing collars and a TAD. In this case, doctor also left teeth, but you have a choice. You can either do teeth or TAD or a combination of both. And then, of course, he scanned the ArchBridge with all of the horizontal wings here contacting. A nice close-up of the ArchBridge. And keep in mind, it's not notice the continuity of the scans, that you just simply go from one side to the other. The rest of this anatomy and even the surgical guide are not necessary. You want to just scan the ArchBridge and traverse from one side to the other. With these scans are uploaded to us. There's the TAD, we have the bite, we have the tissue scan with the healing collars, and there's the ArchBridge scan, and we combine all these into a restoration, send it to the doctor to print in-house. Right, there you go with different screw channels for different screws on the market. Doctor and his team do a beautiful job with printing and beautifying these restorations, and have developed a very good skill for getting patients through this on either the same day, sometimes the next day seating, but either way, and a very predictable protocol with the ArchBridge. When you want to go to final, there are two great avenues. On the left is the patented iJig, where you simply capture intraoral scans, extraoral scans, pretty simple process. We send you back a prototype for the final that is sectioned and that is simply luted in the mouth, equilibrated, and returned to the lab to go to final. Very simple process, thousands and thousands of those completed. Or to the right, Graphenano, simply scan the healed tissue and scan the equilibrated prosthesis from the day of surgery, order a prototype, or go directly to final in milled Graphenano material. Two great options to finish up your case without the need for photogrammetry.